Hello everyone. Today we are gonna learn about choking, foreign body airway obstruction and its first aid treatment. Experiment number 10. Demonstration of first aid for foreign body airway obstruction. Aim: to demonstrate the first aid measures to be taken if an adult, child, infant suffers from foreign body airway obstruction. Before moving to the topic, the question is, what is choking? So the answer is, choking is caused by swallowing a foreign body while eating. So practical significance. An airway obstruction caused by a foreign body is a medical emergency that can be fatal. Pharmacists must create awareness in the society about first aid measures to be taken if someone suffers from foreign body airway obstruction. In this practical, we will learn to provide first aid treatment and save life of adult, child, infant suffering from foreign body airway obstruction so that they can educate the society about the same. If the victim is an adult, ask the person to keep coughing. Do not do anything else, but stay with the person until he breathes normally again. If nothing changes or person is unable to cough or breathe, stand to the side and little behind the choking person. Support the person's chest with one hand and bend him forward. Give 5 firm blows between the person's shoulder blades. To do so, use the heel of your free hand. Verify if the object has come out and the person can breathe again. As shown in the picture presented on screen, this is known as back blow technique. If the object hasn't come out and the person is still choking, stand behind the person and put both the hands around him so your hands meet in front of the person. Make a fist and place it between the navel and lower tip of the breastbone of the person. Hold on to this fist with your other hand. As shown, picture presented in the screen, this is known as abdominal thrust technique. Bend the person forward and pull your fist firmly towards and upwards. Give 5 abdominal thrusts. Hence, it is called as 5 and 5 technique. If it doesn't pass, then CPR is given to the choking person. If the victim is a child, ask him to cough and keep monitoring the object. If it doesn't work, then perform 5 and 5. At last, CPR is the effective process. If the victim is an infant, the baby urgently needs help. Shout or call for help. If you are alone, then don't leave child unattended. Ask bystander to help and urgent transport nearest healthcare. Tell him to come back as soon as possible. Kneel down so that you can use your thighs to prevent the baby from falling. Lay down baby along your forearm. If you are right-handed, use your left forearm. If you are left-handed, use your right forearm. Support the baby's head and neck with one hand without covering the mouth so the baby lies face down, with the baby's head below his trunk over your forearm supported by your thigh. With your free hand, give 5 firm blows with the base of your palm to the area between baby's shoulder blades. Quickly turn the baby while supporting the head onto his back to face you, resting your arm. Check if the object has come out and the baby can breathe freely. Place 2 fingers in the middle of the baby's chest and deliver 5 thrusts, pushing inwards and upwards. Stop after 5 thrusts. If baby is still choking and object doesn't come out, then repeat the process once again. If baby loses the consciousness, lay the baby down on the floor or on a hard and safe surface. Start CPR on the baby. In the given picture, back blow and chest thrust for relieving choking in infants is shown. Complications. Abdominal thrust may result in severe injuries to the respiratory tract, so see a doctor as soon as possible after the process has been done. Role of pharmacist. Preventive measures for avoiding foreign body airway obstruction. Avoid eating during exercise. proper chewing of the food, avoid taking alcohol, avoid giving peanuts or small objects to small children, increase public awareness of choking and confidence at initiating first aid. So this was the demonstration of first aid for foreign body airway obstruction. Thank you very much. Be safe, be healthy.